everyone, Jessica here, counselor at Friends for Mental Health. October is Mental Health Awareness Month in Canada, so we just wanted to take a moment to talk about how to support your loved one with a mental health issue during the COVID-19 pandemic. So first, you want to make sure that you're also taking care of yourself. Check in with yourself. Are your physical needs being met? Your emotional, psychological needs? If we want to be there for others and take care of others, it starts with us. It's the oxygen mask on an airplane. You have to put on your mask before putting on someone else's. If you're living with your loved one with a mental health issue, it's important to maintain those healthy boundaries and limits, and trying to get some time apart as well. That space really helps. If you're not living with them, try to arrange a system where they feel supported and you know how much help you're able to give. If it's weekly phone calls or video chats, just having that frank discussion about what they need to feel supported and what you're able to give in this moment. So take care, stay safe.
Hi everyone. So we're back in the second wave now, and it can be very stressful for everyone, especially those currently suffering from mental illness. So the best way we can help them is to listen to them without any judgment, to empathize with them, and to be compassionate about their struggles, their emotions, and their thoughts. It is also important to have realistic expectations and to understand that it can be difficult for them to accomplish daily tasks such as cleaning the house or taking the dog out. So if you want, you can offer help. However, it is also important to not encourage dependency. You can also provide hope for a more positive future through information about resources that can be helpful to your loved one, as well as focusing on positive aspects in the news or in your daily life. If you need any extra help, please feel free to contact Friends for Mental Health. I hope you're doing well and stay safe.
Bonjour! Alors, à l'aube de la deuxième vague, qu'est-ce qu'on peut faire pour les personnes qui souffrent de problématiques de santé mentale? Je dirais, écoutez-les. C'est un moment difficile pour tout le monde, on a besoin d'être entendu, alors on n'écoute pas pour donner des conseils, mais juste pour qu'ils se sentent vus et entendus dans leur vécu. Normaliser le vécu aussi. C'est normal en temps de COVID d'avoir des hauts et des bas, de se sentir bien des moments, moins bien à d'autres. Alors, normaliser tout ça, ce que ça fait, c'est que ça favorise l'acceptation puis ça favorise la résilience aussi. Quoi d'autre? Passer des moments de plaisir avec votre être cher. Passer des moments où vous allez parler autre chose que la COVID. C'est important d'avoir du plaisir et de porter l'attention sur le positif aussi. Et en dernière chose, je dirais durant ma minute, ça serait montrer l'exemple, prenez soin de vous, essayez de maintenir un certain équilibre, d'avoir pour vous des moments de plaisir aussi, des moments de pleine conscience, de méditation au besoin, mais des choses qui vont vous faire plaisir à vous. Alors, on est capable, alors bonne chance dans ce moment difficile qu'on passe à travers la COVID.
Hello to all people contacting Friends for Mental Health. I'm Cheryl, clinical supervisor. We want to just touch base with you guys and let you know a little bit more as we seem to be going into another wave of COVID. How to help your loved one who has already an illness and now probably a lot more anxiety. I think the thing that's really important is to provide a forum for listening to your loved one. They're probably feeling alone more than ever, and they need someone who can listen. And what's important when you listen is to validate their feelings and their thoughts. And validation means accepting what they're saying as their truth and their reality. And hearing that. It might be scary to hear how alone they are or how fearful they are or maybe how suicidal they are. But listening and supporting them and understanding that they're going through that is really important, just to acknowledge their feelings. That being said, it's not easy to always be the support person. But sometimes we make mistakes. For sure, we do things that are not always the right thing. And it's important to apologize when you do step on their feelings or not acknowledge the pain that they're in. And also then to acknowledge that it's not easy as a family member to go through the COVID. And it makes us feel better when we know that each one of us is doing our best, but that we also have bad days. I think sometimes it's okay to give them a piece of reality, which is we did it once, we can do it again. And they're getting closer to a vaccine, and that's good news. There's a lot of things in the news that make us worry and are fearful and question, and it's important not to focus on all those things that are worrisome, but they are getting closer to a vaccine. There are many people working all over the world to try and slow this down and stop it. So we need to hold on to those two thoughts and then think about this as a challenge. It's forcing us to be more creative. It's forcing us to talk to people maybe who we haven't reached out to in a long time. It's forcing us to find ways to interact that we haven't done before. And we ran some support groups, and I was really interested to hear how people were finding people to interact with, either playing bingo or playing games online. There are ways to find other people by looking for them online. There are ways to get through this. Plus, also the challenge is to spend time developing your own personal skills, be that knitting or reading or writing or quilting, painting. Lots of people did gardening, and now it's time probably to put those things into cans and canning. There's lots of things to do, but we're being challenged to do new things or to find those things that are just good enough for us. I mean, I think Netflix has been explored. There's all kinds of TV out there, but we need to go inside us and develop ourselves. We're going to need that anyway. As we get older and we are more alone, we're going to need to have some of those hobbies and crafts and activities that are more sedentary and more about ourselves. So I challenge you to find some of those and find the ones that are satisfying and learn something new. Learn a new hobby. Lots of people might be learning new languages to talk with people when they're done. There's interesting things on the web about that. And there was all kinds of free things about different museums that are available on the internet. So I challenge you all to keep looking for new things to try. We can get through this. We did it once before. We can do it again. And if you have difficulties, you can always call us at Friends for Mental Health. Take care.